Instrumentation. It is understood that the internal environment within a joint is actually communicated to the outer skin periphery through nerves. So in other words, when there is a disturbance within a joint, neurological communication takes place from internally through the skin adjacent right to where that nerve is disturbed. With an instrument, we can identify that precise level. We have different types of instruments. This happens to be one of the older original temposcopes. There's little thermocouple probes right here on these tips, and those are used when we glide down the spine. So it would be something like this. When we're gliding that scope down the spine, we're looking for temperature differentials at each particular level. It's important your chiropractor uses that on each and every visit. It enables him or her to actually stay focused on care and what your appropriate treatment plan and regimen entails. Next is palpation. All chiropractors palpate the spine. In order for us to palpate, we need to have skin contact. It's difficult to do that through clothing. So female patients, we have them in a gown. Male patients, of course, the shirt would be removed. To that end, we look for specific patterns of swelling, muscle tightness, or what we call hypertonicity, as it relates or associated with specific patterns of joint loss of movement. That joint loss of movement that we find on an examination should be consistent with what we see on an x-ray. But both the instrumentation and the palpation enable your chiropractor to determine what an appropriate schedule of care is and also monitor the progress.